I get to get up every day and work with people that I like and solve a problem that I know it helps people. So this isn't going to work for me. This is just getting up and living.
You're listening to Idea Charger Radio. Hey there, Success Chargers. It's Scott, and welcome to episode 37. You know, one of the things that's really important in my work when I sit down with an organization to help them achieve their highest performance, you know, we talk about building lasting, profitable relationships with clients. And that really starts with understanding what makes you tick, right? And it's not just profitable relationships with clients, but how do you define profitable? In some cases, it's just giving them a peace of mind, and they happen to give you cash in exchange for that. And sometimes it's much, much deeper than that. And that's where today's interview comes from. We're going to be interviewing a gentleman who is the co-founder and CEO of a company called Cariloop. So that's Cariloop.com is where you can find out about them. They have a really unique product that they've brought to market that is sort of in between the healthcare services that so many of us need for our aging parents these days, and those that may find themselves in more of a caretaker role. How do you bridge that gap? How do you know what to do? And, you know, we live in a world where everybody wants to be a business coach or an executive coach, but sometimes I'm trying to be a caretaker and I need a coach for this too. Cariloop has found a way to begin bringing that to market. And it's a pretty neat deal. So listen, I'm going to get out of the way. Let us hear the interview with Michael Walsh. And on the backside, we'll tell you a little bit more about where you can hear and meet Michael if you're in the Houston market here in the next couple of weeks. So sit back and here we go. What is Cariloop, and where did it come from? What is it? Why are we here? Tell us about it.
We provide a service, a healthcare coaching service that allows people to get on a video chat or a phone call with a licensed or certified healthcare professional who is going to answer all of these questions and really walk the family through from start to finish all the different steps and priorities that they're going to encounter. And then we pair that service with a web and mobile platform that brings all the family members into one place online where we can have all these conversations securely and privately, where we can store all of the important documents like a medical power of attorney or a Medicare insurance policy. And you can access all sorts of great resources and content that are really customized to the situation that you're going through. So, I mean, that's Cariloop. You can tell I'm really excited about what we're doing. This is a really cool thing that we get to do every day, help families through this. They come to us many times in a state of panic. And you wouldn't believe, Scott, when you hang up the phone with some of these families, you can just sense the relief that they feel. Now that they know that we're here, that we have their back. I mean, it's a big deal.
So we're sitting here today with the co-founder and CEO of Cariloop, Michael Walsh. Michael, we're glad you could carve out some time to be with us today. As we talk through this, I think you just alluded to really the core message, because there's a lot of tactical elements we could talk about this, and I do want to get to some of those. But I think it can be summed up, if you think about it, it doesn't take much for what seems like a simple issue to get very complicated very quickly. Can you tell us a little bit how? I mean, I'm sure you didn't wake up I doubt that many of us went to school and said, someday I'm going to build this service that solves a big problem that miraculously, I cannot believe, as Joe Calloway would call it, you're a category of one, right? You are the leaders in the space. But you didn't dream this up overnight. What were you doing before this, and how did you stumble your way into co-founding this company?
Sure. Well, I mean, my background here, and when I say background, I mean like quite literally my entire family's background. I mean, I come from a family of entrepreneurs,
Okay.
My dad, my grandfather, I've got uncles, cousins. I mean, we've got a group of very innovative, disruptive people. We don't like to play by the rules, Scott.
I love it.
we
You're my kind of
we
people, man. I
we're
love it.
right. We look at a problem and we kind of scratch our head and go, we could do this better. Maybe it's just arrogance. I don't know. But I come from a family of entrepreneurs. I mean, my father, I was raised watching my dad build his business in Chicago and succeeding at it, just working so very hard at it. And his business, it's landscape supply. So it's not like it's
Okay.
anything like and he'd probably, if he listens to this at some point, he'd probably laugh when I say this. He knows he's not doing something revolutionary, but what he would tell you is that he does it in a way that really helps homeowners and helps other businesses in the area, get the materials that they need to really have and build a great, a great landscape experience for their home. He wants people to enjoy their homes. That's what he would tell you.
Yeah.
So, I mean, I come from this family. I watched my dad build this business. I go to school, and my dad was very specific with me when he sent me to college. He said, you're going to go to college, and you're going to go out into the world, and you're going to do your own thing. And I think he said this because his father, my grandfather, had kind of pulled him into the family businesses very early on.
Hmm.
My dad didn't really get a chance to go to college and pave his own way early on. I went to school. I studied business. I ended up working for a management consulting firm in Chicago for about 4 or 5 years. And most of my clients were in the healthcare space.
Hmm.
So for the first 4 or 5 years there out of college, and this was a kind of a cool time in our country, right? This was 2007 to 2011, 2012. I mean, the economy had just literally taken a dump on everybody. The whole business environment was changing. People are getting laid off. The Affordable Care Act comes out in 2010, and the whole healthcare landscape completely shifts. I mean, lots of interesting things going on when I started my career. And I fell in love with the dynamism of the healthcare space and just all the cool things that were going to be in the pipeline for the next 10, 20 years in
Hmm.
healthcare. So back in 2009, I guess the end of 2009, 2010, a good buddy of mine, one of my best friends since we were kids, was working in the senior living industry up in Minneapolis, Minnesota, and came to me with this cocktail napkin of an idea. And he wanted to create a system, kind of like Open Table for restaurants,
Okay.
where you could see, the tables at your restaurant that are open, and you can make a reservation. And
Sure.
he wanted to create a system where you could see open beds for nursing homes and assisted living facilities. Like he wanted to make this.
Wow.
And I'm working for my management consulting firm, and I'm thinking to myself, like, it sounds cool. I mean, I'm not really interested in that. And at the time, he wasn't even really asking me, but he was telling me about this, and I'm looking at him, and I'm thinking to myself, I've been looking for. I love healthcare. I've been looking for what is going to be that thing that gets me kind of on that entrepreneurial track. And what better opportunity than to build a company with one of my best friends, right? Like I'm
Absolutely.
25, 26 years old. Might as well take a chance at it, right? So he wanted to build this thing, and so in 2011 I left my company, and him and I moved to Texas and started laying down the foundation for what is now Cariloop, and it's been a hell of a ride ever since. It's been a lot of fun being down here and getting all this stuff set up.
Texas as a state, I think is a pretty attractive place to come and start a business. It's a good environment. Certainly, you're in the Dallas market, and Dallas is a vibrant, great city. Spent a lot of time there, and really enjoy it. And it's interesting that you kind of found your way through this because I want to talk about a couple of the numbers because I pulled these right from your website and I thought they were fascinating when you stop and think about it where we are in the workforce today. All right, so in fact, anybody, by the way, if you're interested in meeting Michael or myself, I know that we will both be at the uh, 2016 Gulf Coast Symposium on HR issues. Michael, you guys have a booth there, is that correct?
Correct. Yeah, you'll be able to walk up to the booth, and we'll demonstrate the video coaching and the web and mobile platform for people. They can kind of play with it and see what it's all about. So yeah, we're looking forward to it.
That's cool. So if you're listening to this between now and May 11th through the 13th, if you're going to be in the Houston area, swing on by the NRG Park there that's adjacent to the stadium, and we're going to have a good time. I know I'm doing some stuff. In part of my research, for the breakout session that I'm going to be doing, I started looking at what is the composition of the workforce in terms of generations. And, everybody talks about, the millennials. And
Right.
it's like, okay, I'm just exhausted. Because, I think we have to think about it. There's deeper issues there than what generation somebody is. Because the last big generation that got a lot of buzz were the baby boomers.
Right.
And the baby boomers are finally, now I've been hearing that they were going to retire since about 2000 when I was in the financial services industry. They're like, oh, it's going to be the greatest transfer of wealth ever, and there's so much money in motion, and you're going to make a fortune, which is true for a few people, except that the market's reset about 3 times over the next several years.
Yep.
And you saw that as well.
Changed the plan a little bit.
It did, right? So a couple things have happened. One of which, a lot of those boomers are still in the workforce today. They didn't think they'd still be there. Some are there longer than they wanted to be, but they had to be there because financially it was possible or necessary. But we're starting to see now, there's a real caregiver issue as we have an aging population. Okay, some of the stats you've got here. 17% of the workforce today, that's the currently active workforce, also serves as a caregiver.
Right. I mean, so just think about the magnitude of that number. I think the last time I looked at the statistic, we've got 121 or 122 million people currently in the workforce in the United States. So, I mean, you're talking about, 25, 30, 35 million people? Am I doing my math right?
That's about right. Yeah.
Yeah.
I mean, it's a staggering number, right? I mean, it's not like, oh, it's those nice people from our church down the street. It's like, no, it's like a third of your neighborhood.
Yeah. Well, and I guess you got to also put some fencing around. This is what we run into a lot, Scott, is that people don't want to admit that they're a caregiver.
Yeah.
And if you're going and you're cooking meals for mom because she just can't, go over to run out to get food, that's a caregiving activity. It is.
Sure.
If you're going over to do mom's bills every Sunday, that's a caregiving activity. People don't want to necessarily acknowledge that they're a caregiver sometimes, and we hate to break the bad news to them, but it's
right.
this is the truth. This is another job for you, and that's I think the next statistic on the website. If you want to mention that next.
Yeah.
The one I think it's 21 hours a week that caregivers are spending on average doing these things, and it's not exclusive to actually physically caring for mom. It could be anything. 21 hours is a lot of time.
I think we start to see the impact of that even before you approach some of the stages you mentioned. It's like, hey, let's make sure mom's got food in the in the pantry. Let's make sure there's stuff prepared that's in the fridge. But I mean, it's like just as you watch your parents get older, you start to think about, right? So the conversations, and maybe you're not actually physically doing as much, but you're starting to have deeper conversations about, hey, what did the doctor tell you last week? What are you hearing? What's going on? Are you going to see this specialist? This has happened for my family, both with my parents and my in-laws. Just as they're aging and tackling a number of issues, and it's become like it's a significant part of how we spend our time. All the time.
Right. We grow up. We're raised here. It's just part of our values. We take care of family. There isn't a question about it. It's just part of what we do, right? If something happens to family, we take care of family. But when you find yourself in this position in life, which tends to be, you're in your 40s and 50s, most oftentimes, but we're seeing people even in their 20s and 30s. You're talking about the millennials. There's plenty of millennials that are jumping in on caregiving activities now as well. You don't realize how much time you're spending. I mean, just the text message chain over here to, update your sister on what's going on or what happened to the doctor. And then the phone calls that you made when you got home from work to call in mom's meds and pick them up, it all adds up. And we think that if we could come into the marketplace and say, instead of you spending all your time trying to even figure out what to do, if we could make it easier for you and set the table for you so that you really could focus that quality time on eating dinner with your mom or dad instead of having to figure out how you're going to go to the grocery store. Just set the table for you so that you just do it. We think that there's a lot of time, a lot of stress, a lot of money that can be unlocked.
there are a lot of industries built on this concept of being your trusted advisor, right?
Sure,
And
of
and and,
course.
and you and I have talked about that. My listeners know I spent about the first 12, 13 years of my life in financial services. So I did a lot with banking, and the majority of that was actually as as a retail investment broker, an advisor working with individuals. I'm smart enough to go do research. I have a finance degree. I can, go dig in and find out where my investments ought to be. But it's helpful if I have somebody to bounce those ideas off of, or someone who knows, what's in my best interest, just to make sure as a double check and a set of eyes, to have a financial advisor.
Yeah.
Same thing with,
The one thing that I would say there is that differs here is that when you're going and you're looking for where you want to, allocate your portfolio, you're not in a sense of panic when you're doing it.
yeah. Well, that's it.
Like you haven't been delivered an Alzheimer's diagnosis within 24 hours.
Yeah,
So it's almost a completely different paradigm in mindset that you're in when you're doing that research alone.
well, anybody that starts out as an entrepreneur, you're doing everything on a shoestring. So, you do your own taxes for those first few years, and then pretty soon
Sure.
that gets complicated. So maybe you first hire a bookkeeper, just kind of make sure your entries get in a timely fashion, and then, you've got a CPA who will think about your taxes more than once a year when you file
Hmm.
them, right, to help you put together strategies. And we're okay at picking out doctors. The challenge with that is people tend to pick who's their doctor, what facility they go to, based on the healthcare plan that their company happens to provide them.
Right.
I think it's
Exactly.
ludicrous in this country that the responsibility of healthcare seems to fall to the employer rather than some other source. And it is what it is, and I understand how we got there. But what you guys do in this category of one, and I want to step back to this, is you are stepping in as that trusted advisor that can help somebody say, look, this is complicated. There's a lot of moving parts and pieces. It is challenging to keep up with the changes in healthcare legislation, in what insurance companies can do and not do, what they do well, what they don't, what facilities can do. Can you walk somebody through, like when I pick up the phone and I call Cariloop and say, all right, I'm underwater and I don't even know what I don't know. How does that
Yeah.
conversation go?
That's actually what we specialize in, believe it or not, because that's most people.
Sure.
They don't even understand what the first question should be. So the experience, that first consultation that you have when a member signs up and they get with their healthcare coach, and we tend to, when we have that first conversation, we want to include as many of the family members who are going to be part of this as possible, so they can all hear it, they can all be part of this experience together.
Hmm.
Because again, like we don't want you to have to hang up the phone and go re-explain it all. Like that's time. That takes time.
There you go.
So if we can get you all into like a video conference and do a whiteboard session, the coaches are going to take you through a series of steps to help you really flush out kind of where are we right now? Like what has happened, and what's the financial situation look like? What's the legal situation look like? Who are the key players here in the family? What are your goals? What are your fears? Like it's a very open conversation, a very vulnerable conversation about what you're going through. And the coaches, because these are licensed and certified healthcare professionals, many of whom have been in the space for a long time, they are very quickly able to analyze all this information you're giving them and really sort of chart a path forward and prioritize the steps along that path so that, for you, if you're looking at this and you'd see 10,000 things that need to be done, the coaches are going to say, yeah, there's 10,000 things that need to be done. But right now, we're going to focus on these three. Forget all this other stuff for right now. Like, let's
Right.
focus on these. These are the most important things for us right now. And that might be, we need to find mom's long-term care insurance documentation. We need to find the medical POA in case someone needs to make a decision. They're gonna help you understand that. So back to your point about you don't know what you don't know, and you don't know what to ask.
Hmm.
They're gonna start kind of walking you through that, and together we're gonna help you discover what that means, and you're gonna walk away from that first conversation really with a sense of relief. Like I said, you're gonna feel much better about what happens next, and they're gonna make sure that they're there each step of the way.
I really applaud what you guys have identified, because your company really is a great example of that. that extension of what your family has done all along. You said your dad, was in that landscape distribution business, right? Basically,
Right.
of
Yep.
all the equipment that it takes to make that happen. I can't tell you in my work how many companies I find that people would just walk past and go, "Oh, that's not very sexy." I want to be the next Apple. I want to be the next, Starbucks. And I'm like, you realize that Starbucks created a category of how to do coffee different,
Yep.
right?
Right.
And you figure out that Apple said, "Yep, we make computers, and there's computer companies before, but we make it different." I think instead of being the next something else, you guys exemplify what it means to be the first Cariloop.
Yeah, that's what we hope. We look around at some of the other options that are out there, and these are I don't bash substitutes or competitors.
Sure.
These are great options for people. We just see it differently. We see the experience being different. We look at it and see an opportunity to really change how this could go for thousands, millions of caregivers from this day forward. Just being able to, when you're in this moment, open up a mobile app on your phone and press a couple of buttons and have a very honest, frank conversation with a person that really can understand what you're going through and help you get through it. I mean, we think that this is where healthcare is going, right?
Right.
This is part of what the industry is seeing right now with the adoption of all these telemedicine companies and virtual reality and wearables and mobile health, and there's just so many cool, innovative things going on right now. We see this as sort of being a way to, like you said, focus on something that maybe isn't as sexy,
Yeah.
but bring some innovation to it in a way that really changes how it works.
Well, yes, and it's it may not seem sexy, but when you need it, it may be the sexiest looking thing you've ever seen.
Sure.
I mean, it really brings that all to life. You stop and think about it's not just the time, right? But it is the lost productivity. It's like you guys put a number to it. You talk about over your lifetime, just by being a caregiver, your estimates show, somewhere upwards of 300,000 plus over a lifetime of lost wages.
Yep.
Because it's, you didn't stay to do what you really needed to do, but you actually had to go because you were taking care of somebody else. Employers pay a cost too. And it's, you guys have a number there somewhere around $2,100 a year per employee who is working as a caregiver, which we have already identified. It's about 17% of your workforce.
Yeah,
So,
I mean, and it's interesting. I'm having to spend, because we're in this category of one, Scott. You can imagine I spend a fair amount of my time speaking to CEOs, CFOs, or directors of HR, and I'm having to explain this to them, and a lot of them kind of look at me and they don't believe me, and it's like, well, again, you don't have to believe me. This is independent research. Like I'm not making these numbers up. This is research that's been done by very noted and very decorated financial institutions.
yeah,
I promise you this is here, and you may not realize it's going on because your people are physically walking into work every day, but what you don't realize is that this is what they're dealing with at home, and they might be sitting at their desk spending their day Googling things and texting with family members trying to solve for
sure.
this. So yeah, we see it, we know it's there, and we're excited about the opportunity to introduce what we believe to be the cure to a disease that many employers don't even realize they have yet.
Oh, that's good. You should put that on a T-shirt.
Well, that's the truth, right?
It is, right?
And you look at the charts of the aging demographics in our country. It's like this is coming, guys. This is going to be a big deal in the next 5 to 10 years. So we feel very confidently that we're going to position ourselves at the front end of this, and in that category of one is not going to be a category of one for very long.
Well, I think you're right, and I think that the best what is it they say, the best compliment to what you're doing is when people start trying to copy you.
Sure.
And
I
somebody,
welcome it.
yeah, bring it, right?
Bring it on.
Well, the other thing it does though is it further validates the ideas that you guys have already put into play, and it would make you feel really good. It's interesting. I was just thinking about, you mentioned how you guys leverage that screen-to-screen technology, and for listeners of the show, back in episode 35, we brought on a friend of mine, Doug DeVitri, who talks about using screen-to-screen technology to improve customer service. And you guys at Cariloop, you're bringing screen to screen, using screen to screen technology to actually deliver your service, right?
Right, exactly. I mean, if I don't want to scare anybody if that makes someone a little bit turned off by this idea. Like, we can do it over the phone as well. But what we find, to your point, what we find is most effective is to use that video conferencing or that screen to screen where you can see your coach, you can see what they're writing, you can see what they're capturing, and it's really kind of this interactive experience where you're working together, you're all pulling in the same direction, and like we believe that video really adds a lot to the experience. So we try to incorporate it as much as we can, but we have people also that maybe they're not comfortable with it or they'd rather not. I don't want you to see me, whatever it might be.
I'm at home with my curlers in my hair.
Yeah,
and
we get it. We understand.
Hey, totally good.
But
I mean,
you're right. It adds a lot to it.
It does, and I brought it up since we'd had a recent guest on that was talking about the technology, and I wanted to show that connection. But you're right, it's about, and I love that you guys think of yourselves as you're just coaches. You're not the healthcare provider. You're not trying to manage someone's care. You're just helping somebody decode. You're like the decoder ring. The Cracker Jack people came out this week and said they're no longer going to put prizes in the bottom of Cracker Jack boxes. Yeah, they did.
That's why you buy Cracker Jack boxes.
That's exactly right. So now they're just going to have stickers with like QR codes on them so you can do mobile stuff on your phone. I'm like,
that
really?
That sounds boring.
Right. I don't go to a baseball game because I want to get my phone out.
No.
I want to eat peanuts and Cracker Jacks and a cold beer and enjoy an afternoon at the ballpark, right? That's what I'm doing. And we'll have to look into that. But
yeah,
sorry for that digression. You guys are really you're like the secret decoder ring, though, right? I mean, you're helping people just make sense out of what they have, so at least they understand the options, because it is terribly overwhelming to, you call your healthcare provider, they're like, if you'll go to the website, if I could figure your website out, I would have not had to call you.
Right. See, and right there, like they're making you do it alone. They just don't have time. It's not built into their operating model to sit down and walk you through this. Like their focus is on getting the next patient in and out the door, if it's a social worker at a hospital, or if it's a admissions person or executive director at an assisted living facility or nursing home. They just don't have the time to sit down and walk you through this. So to arm a consumer or an individual or a family with the technology and the services to really get through this, that's exactly what we think we represent. You don't have to do it alone. Like no longer do you have to sit there and spin your wheels on a website or call some nameless, faceless 800 number and have them give you a list. Like we just don't think that is going to be the way that consumers want to go through this here on out. And you bring up a good point about the coaches. This is actually kind of a fun debate that continues to be had, and within our team, we've gone back and forth on, what is the right word or the right phrase for, what we now call our healthcare coaches. And we've gone all around the room and thrown all sorts of phrases and terms out, and we keep kind of sticking to healthcare coach because we think just what you just said, Scott, that we're sort of playing a role where we're guiding, we're nurturing, we're listening, but by and large, we're not here to do it. We're not here to go out there and execute the plays.
Right.
We're here to tell you how to execute the plays so that you feel in control and you get through this more effectively. So, we keep kind of going back to this idea that that's what a coach does.
Well, all right, so some people are, let me ask you, I've got an important question that comes to my mind because, one of the things that sometimes gets in the way of a great entrepreneurial idea is this little thing called compliance and the legal issues that go with that. I'm certain playing in the healthcare space in some regard, what impact or in what ways do you have to be sensitive to the HIPAA requirements that are out there?
Yeah, it's a good question. And we definitely take privacy and security very seriously. I've had several different healthcare lawyers and firms kind of review our operating model and point out the different levels of risk along the way. And I guess I can say from our standpoint, we've taken the precautions to make sure that if we were to have to stand up next to a HIPAA audit or review, that we pass the test. Like now, I say that first because what we found actually as we've reviewed our model is that we don't actually fall under the umbrella of a covered entity.
Okay.
Because we're not dealing with patients, we're not dealing with insurance companies, we're not dealing with health systems. Like we're kind of outside the envelope. We're dealing with the children who are just looking for the guidance, the help, the support as they're caring for someone else. Now, of course, the caregivers themselves are sharing information about what's going on.
Sure.
And so again, that's why I point back to, I mentioned it first, that with our technology platform, with the coaches that we use, the coaches are all licensed and certified healthcare professionals. They're very aware and understanding of HIPAA, and they've been trained on it. The technology we use, we follow all the same encryption protocols that would be expected of a HIPAA-compliant technology platform.
Okay.
Our server and backup environment is all HIPAA compliant. We have taken the steps necessary to follow it, even though we technically do not fall under the label of a covered entity.
Great.
So we want everybody to feel like probably don't do a good enough job of advertising that. That's something that we probably need to be better about explaining to people, is that this is completely private and secure.
Mm-hmm.
It's you and your coach, and most oftentimes on the back end here, as we're working with some of these families, we have kind of the basics on the individual caregiver member themselves, but a lot of times we don't even use the name of the actual patient in our system. If the family wants to, we can completely personalize it around them, but it's not required.
Let me ask this, because I know there's a couple of ways that people can really sign up. You offer the availability for just an individual that says, I need this, I would pay for it. It's remarkably affordable. That's an option, but you can also work with employers as well. Could you take just a minute and kind of explain how people can get access to Cariloop?
Sure. So if you're listening to this and this is something that you want to learn some more about, you can go to cariloop.com. It's our website, and there's information there on memberships. A membership for an individual family is $300 a year. So we're talking less than $1 a day for you to have unlimited on-demand access to one of these healthcare coaches and the use of our technology platform. So extremely affordable, like you mentioned. But where we're finding that we're getting a lot of interest is with employers, membership groups, just large populations of people where, as we talked about earlier, where productivity stands to be affected by all of this. And for an employer, it depends on the size of the employer, from a little bit different of a pricing model for a 25-person company than a 25,000-person company, as you can imagine. Mm-hmm. But there's ways that the employer can cover the cost for their employees, and again, it can be extremely cost-effective and affordable. But there's also ways where the employer could offer it as a voluntary benefit or perk as well, where very similar to a family signing up for $300 a year, we could offer it at like $240 or $180, just again depending on the size of the group. Mm-hmm. So we're really excited about being able to sell this both ways, to generate both revenue streams early on.
Sure.
We anticipate a lot of our growth is going to come from the enterprise side, but in the early running here, just through word of mouth and PR and awareness campaigns, and we're starting to do some advertising. People are finding out about this, and again, for less than $1 a day, to come to the website, sign up, and get this problem solved. We're not seeing much pushback in terms of the price.
Hey, you burn 1 or 2 days trying to track down some of these questions, and you would gladly write a check to somebody for $300.
Right. And it covers you for the year. It's not just a one-time thing. It's you've got access to this for a year. So, we get asked oftentimes too, Scott, about, well, once I solve the problem, maybe the problem is we're looking for an assisted living facility for mom. Well, once I solve it, like, why do I need you? And it's like, well, at any point, if mom, if her condition worsens, or you're not happy with the facility, or you've got more questions about how to pay for, it doesn't end.
Right.
It's not over. It
isn't over. Yeah.
No, it's not over with just because you found, we helped you solve the first problem, but this doesn't stop. Again, it's very dynamic and fluid. It changes rapidly.
Yeah.
So, the membership is set up to be an annual thing where, okay, maybe something doesn't happen for 3 or 6 months, but there's a written record of everything we did, and all the conversations are here. And if you need to quick check in with your coach every so often, or if the coach wants to check in with you, that's what the mobile platform's for. And, that's why you keep the membership. Just in case something happens, we are literally a couple of clicks or taps away from being able to jump right back in and help.
All right. So the the website is Cariloop.com. That's Cariloop.com. And if somebody they're old school, right? They just want to call it in. They want to get on the phone. What's the number they should call?
It's on the website as well. I believe it's 844-790-LOOP, which is 5667.
Okay.
So I think that's on the website. At the very bottom there, they can give us a call, and if they press, I believe it's 1, they'll get a coach on the phone immediately. And if they're not a member already, they can get you signed up and get you started. It's pretty simple.
See, and it's just a live person. So if you have real questions, it's not going to be ask
press
about
one, press 1 for this, press 4 for this, press 6 for this.
Don't get lost in the answer tree from down under.
Yeah, we like to keep it simple.
There you go. Well, Michael, as we kind of bring this to a close, I have 3 questions I like to ask my guests. I call this the lightning round. So we're just kind of looking for maybe some 20, 30-second answers, something quick. First thing that comes to mind. The first 2 are amazingly simple in the question, but they can be a little dangerous or provocative sometimes when if you really think about what it truly means. So now that I've set that up, are you nervous?
You put me on the spot. Let's go. I'm excited. Bring it.
All right, here we go. Ready? Number 1, what is success?
Oh, I'd say success would be, I'd love to see us help 1 million families. That's success.
That's awesome. What does happiness mean to you?
Helping 1 million families. No, I mean, personally for me, happiness to me is waking up every day and not thinking that what I'm doing is work. And I'm there right now. I mean, I never think of this stuff as work, Scott. This is just, I get to get up every day and work with people that I like and solve a problem that I know it helps people. So this isn't going to work for me. This is just getting up and living.
That's cool.
To me, that's happiness.
All right, so here's the third question, and it's one that's going to reveal the most about you. Boxers or No, I'm just kidding.
Both?
It got personal, didn't we? No. We're going to look at a window into your soul here. Michael, we're going to say what would happen if you got something happened and you got sent off to a remote island to live out your days, and you have some remarkable access to creature comforts. But you're a bit limited in that you were only able to grab 1 musical album on the way out the door. So you've got 1 album that will be the soundtrack that stays with you for the rest of your life. What album do you have with you on that album? Oh,
man. I could think of 2. I'm a classic rock guy myself.
Okay. Yeah.
And 2 of my favorite albums. Do I get 2 or can I only pick 1?
Well, because
they're two completely different vibes.
Like
one's more like I'm gonna sit on my island with a cocktail and listen to music, and the other's like I'm pumped. I'm building a house made out of palm trees.
All right, I'll give you 2.
I would say Bon Jovi, "Slippery When Wet."
Nice. Okay.
And I would say the Eagles, "The Long Run."
Yeah.
Those would be my 2 albums I would take with me.
That is fantastic. Well, ladies and gentlemen, you have had a wonderful time here listening with Michael Walsh. Michael, thanks so much for being with us today. We enjoyed having you on the show.
Yeah, thanks so much, Scott.
All right, Success Chargers, I hope you enjoyed that interview as much as I enjoyed giving it. And listen, I wanted to remind you where you can find out more, to visit with Michael and other members of the Cariloop team. They're going to all be out at the Gulf Coast Symposium on HR Issues. This is the 25th year of this event. It'll be at the NRG Center in Houston, Texas, May 11th through 13th. I will be there as a speaker. I'm doing 2 sessions on the 12th, 1 in the morning, 1 in the afternoon. They're going to be fantastic. But stop by the Cariloop booth, visit with Michael and the whole crew there from Cariloop. They're going to have a display set up where you can actually see what it's like to have one of these teleconferences with one of their remote coaches, so you can experience that right from their booth. Gosh, who else do I know? I know a lot of other people that are going to be there as well. My friends from the Jill Hickman companies, they do some great training as well. They're going to be out there. They've got a booth. They're going to be have some folks there and speaking. I know that I think Jill is doing a presentation, and they got some giveaways and other stuff. So man, just listen, come out to the event. If you haven't already registered or if you can get yourself to the Houston area, it certainly is one of the premier events of the year for HR for professionals, and it is the symposium you want to attend to find out what's going on. But listen, going back to the interview, if you've got something you're passionate about and you think you could make a business model of it, and you think it's something that people would benefit from, follow your dreams, chase your heart, get out there and do it. If it starts out as something you're doing on the side, that's great. If you can turn it into a full-time passion, go for it. That's what being a success charger is all about. We'll see you again next week with another exciting episode. If you enjoyed what you just heard, please post your 5-star review and subscribe to Success Charger today. Your future is waiting.